started. It is my pleasure to be with you here today. We're going to be having a 3-part class, and this curriculum is brought to you by AARP, and it is called Living Longer, Living Smarter. And the idea here is to prepare yourself for what may come for you or for your loved ones. None of us know the future, but we know that there are changes that will happen naturally with aging. There are healthcare crises. Many of us know somebody that has had something happen in their life that wish they would have had a plan, or they would have had shared their plan, and so forth. And so this 3-part series, this first part is going to be going over home and community options. And then we're going to talk about legal and financial options next week. And then the third is going to be diving more into health and brain health and cognitive. So I'll go ahead and share my screen here. And we will get started. So again, my name is Karla Frese. The last 12 years, I have been helping families navigate healthcare journeys. And so we're going to be touching on some experiences, and I'd be happy to share things that have worked for others that we have found, and a lot of new improvements as well, and opportunities that are there for you. When we look about planning for your future, there's so many benefits to thinking ahead. Right now, you've got time to research to get exactly what you want. And that is exactly the goal. Either you plan for it and get what you want, or somebody else does. So our goal is to give you more independence, more freedom from being overwhelmed, to hopefully hang on to family harmony, and letting your family, friends, and neighbors be part of what you're going through in your journey, and to live more fully and more comfortably. So we're going to be talking about long-term care. Long-term care is day-to-day help for people with illness, disabilities, other conditions. Most of them last a long time. Some people may need long-term care for several months, others for a lifetime. For the first time in history, living a long life isn't a rarity. If you're 50, you could still have half of your life ahead of you. In fact, half the people born today will live longer than 100. So, really the term aging has just become quite different with technology and the medicine that we have today that we didn't have years ago. So the fastest growing age group is adults 85 and older, and a longer life expectancy means to prepare for long-term care, because at some time you will need it. The best time to plan for long-term care is now. And that's what we're going to do. Part of today is taking care of yourself, your plans, and knowing what those costs are associated with them. So we're going to look at some details about your home, your safety and your comfort. We're going to look at discussing housing options and what's important to you. What are you looking for in your lifelong space? And look at some community opportunities and services that are available. When you look at your goals and your neighborhood and your home, we really need to evaluate beforehand whether or not it can be a lifelong space for you. This picture has kind of an example. Somebody has a pet, and oftentimes that is so important. They're just like family. And if you have a space where you can continue to accommodate and care safely for a pet, and you can see here in this other picture, you've got a home that has added a ramp. In a recent study, 8 in 10 Americans plan to age in place. That is exactly their plan. And so the question is, can your home or your residence meet your needs? So one of the exercises that we'll do, I'm going to stop my share, for example, so I can see you. If you could hold your hands up so you can show all 10 fingers. What I want you to do is when I read these questions, if you agree or if the answer is yes, so put down a finger. I can safely enter and exit my home. If needed, I could add an entrance that could be modified for handicap accessibility, such as a permanent or a temporary ramp. There could be a master bedroom, full bathroom with a shower, that's important, and a kitchen on the same floor. My bathroom is functional. I could have grab bars, or maybe you already have them, a handheld shower and a shower chair. Your kitchen is functional. You can reach items, or you could lower them to a safer level. For example, putting a microwave on a countertop. You have room for equipment. For example, you could use a walker or push a wheelchair through a doorway that's at least 36 inches, or it could be widened to 36 inches. You could make room for supplies. For example, if you needed an oxygen tank or dialysis supplies. You have already started or you're planning on doing some decluttering to reduce the risk of falling through walkways. You're open to technology to increase safety. For example, wearing a wearable, a smartwatch that maybe has fall detection, GPS tracking, or vital monitoring. You are open to smart sensors so that you're more aware of inside or outside unexpected activity. Your kitchen cabinets and your shelves are easy to reach. And yeah, we're going to touch on some other things later, but does everybody mostly have their fingers down? All right, good. Couple left. So when we look at some of those questions that I asked you, AARP has a wonderful home fit guide that goes into more detail into those questions, and it actually will guide you room by room, things that you can do now, whether that is, I'll show you here in a minute, a to-do list of things you can do, or a contract list of things that are advisable for a contractor to do. But if your goal is to make your home a lifelong living space, what you can do now to make sure that that happens. So again, this guide can be downloaded and it'll go through room by room, things that you can do to have a safer setup. The bathroom, again, we kind of talked about that on our checklist. There's a do-it-yourself list, things that you can do, and there's a don't do-it-yourself list, things that you need to get a contractor to do to make sure that they are done correctly. So again, that can be downloaded and a wonderful checklist. So if you're working on your Christmas list and your family and friends want to know what you want for Christmas, you can surely look at this to-do list and maybe there's some ideas there that they could come over and help with. Again, that can be downloaded, and there's a home fit questionnaire guide. So I just asked a couple of these questions that many of you answered yes to quite a few of them, but you can download it for a complete list of safety issues. This would also be very similar to what occupational therapy would look at when they're doing a home safety evaluation. We do that quite a bit. The other thing that's becoming more and more popular is using technology to help. And that is wherever you live, whether you're in a residence, whether you're in an independent living, whatever, any type of community level. Smartphones, tablets, and computers, this has been helpful to not only enable you to connect with people, but also to monitor health. Smartphone monitoring apps, voice-activated medical alert systems. You've got the opportunity for GPS tracking, for vital tracking, and this has been great not only to keep manage chronic diseases, but also to make sure that you feel safe. Sensors and tracking devices. So when you think about, monitoring your heart rate or vitals such as, oxygen, temperature, etc., many of these apps allow you to enter in that information, and it can connect to your healthcare providers so that if there is a red flag or something's not right, that we're able to be proactive in monitoring health versus reactive and ending up in an emergency room. So when you look at what's important to you, there are so many things, and it really starts with your goals, and whether that is your freedom, you want control of your schedule, your independence, you want to be near family. Maybe you have just way too much and you're overwhelmed and you want to downsize. Maybe you want to stay in the same neighborhood where your family lives, or maybe you're going to move near them to have more family time, more quality time with them. But really looking at, what are your goals and how can our community help you meet them, and having a plan in place. When you look at different community resources, there's exercise wellness programs, and that might also include health management. Maybe right now, some increased telehealth. That's increasing more and more, especially in the circumstances that we're in. Help with transportation. Oftentimes, that's a really big change in someone's life when we're not able to drive anymore. And so being able to hire that or arrange transportation when we need it. Chore services. If there's any sort of a risk, and you have somebody else that you could hire to help with snow removal, with leaves, with cleaning, now's probably the time that you need to look at interviewing and finding somebody that you trust to do that. Maybe there's meal delivery options or home care services. That's what myself and my team does. And so if you're looking at a companion or a caregiver to help with cooking or cleaning or activities of daily living, such as standing by while there's bathing, things like that, medication management, those are all resources that are available that you need to look at. If you needed the help, what would you do and who would you bring in, versus waiting for a crisis and then just settling on the first person that you come across. So some of that will depend on preferences. What do you need right now? And what are your resources? There's financial aspects to think about, and that might determine how much and how often you can have that support. And also looking at, what really is the support that you need, and maybe anticipatory needs. So if you know yourself or for someone else, if there's a recent diagnosis, if it's a progressive diagnosis, a chronic diagnosis, to prepare now, because things will only get more difficult. They'll only get more complex. So if you can bring in that support to know what those next steps look like. When we think about housing choices, there's just an overwhelming amount of options. Lincoln has 55 plus communities. You've got the retirement communities that offer you, meals and housekeeping. Village and home sharing arrangements have become popular in some states. We don't have as many of those options here in Lincoln yet. Moving in with family, maybe there's family that is expecting and they built or they bought a house knowing that one day you might live with them. Government housing, or if there's low income or aging disability, you might have in-home care companion or caregiver come into your residence. Continuing care retirement communities, when you look at communities that have different levels, so when you go to assisted living or you move to a different wing for memory care or skilled nursing, so there's different levels of care all on one campus. Assisted living facilities, and that also includes a memory care. Memory care is licensed as assisted living with a additional aspect, which would be a secured enter and exit, and skilled nursing. So when you look at that senior living spectrum, This can be kind of overwhelming to many people when you look at the level of care and supervision and the cost. We're going to dive more into the cost here shortly, but it is there. You do have a lot of options, as we mentioned. Medicare was never designed to cover long-term care. There is kind of a misconception out there, and so it's really important for you to educate yourself to know what Medicare does cover and what it does not cover. If you have questions about your Medicare coverage, you can go to medicare.gov. It's intended to provide health coverage. Over 50 million Americans have it. And when you understand Medicare, you really can make the most of it, understand what it does cover and what it does not cover. Medicare will pay for some home health care, but only if doctor orders the home health care. There's a skilled need from a nurse or a therapist. The person is homebound, meaning it is a taxing effort and you need assistance to leave the home, and you really can only leave for doctor's appointments, hair appointments, and hair, doctor, and church. It's short-term and intermittent, so know that this is not long-term and it's not going to be extended period of time that the therapy's there. It's going to be specific purpose, physical therapy, occupational therapy, speech therapy, and then they're in and then they complete their task and they're out. And they do have to be a Medicare certified agency. When somebody gets worse or when they go to the hospital, Medicare will cover skilled nursing care if the skilled nursing or rehab is ordered by a physician. There is an admit from a hospital after a 3 midnight stay. And again, that has to be under admit, not observation. So that's really important if you or a loved one is in the hospital that you ask that because it does have to be under admission to count for that Medicare reimbursement. You have to be discharged. So you never want to leave against medical advice. When you do that, you won't have the discharge orders to cover your rehab. You might also risk not having your hospital stay paid for, and they're not going to give you any prescriptions. You're going to have to go to your own PCP for that. So never leave the hospital, AMA. Medicare pays 100% for a 1 through 20, and you pay a copay. Days 21 through 100, and then after 100 days, you pay the cost. But the average day really is 23 days. It'd be really rare for somebody to stay up to 100 days. So that's kind of what that looks like. If you want to, if you're in the position where you're looking at comparing nursing home or skilled nursing, you can go to medicare.gov and you can look at their information, their ratings, their health inspections, staffing, quality measures, etc. And you can look up the rating and you have a choice of where you go or your loved one goes. And so I just typed in 68506 because that's the zip code that I live in. And you can see here the ratings that will pull up based on their last reviews. So, and then you could click on there to learn more about why the stars are the way that they are. But know that that exists, and it's an additional way, again, for you to educate yourself. Okay. Can you see my PowerPoint again? Okay, I see some head nods. Okay, we're going to touch base on Medicaid really quickly. People will interchange the words Medicaid and Medicare. Medicaid helps people with low income and assets pay for their medical and long-term care costs. If you have very limited financial resources and Medicaid's your only option, that's something your social worker, most likely Aging Partners, is going to help you with. The coverage varies from state to state. You have to meet a pretty strict financial need. There is a 5-year look back. And so make sure that if you yourself, or if you know somebody, or you're helping somebody with a spend down, that you are doing that appropriately. And typically you're able to keep about $2,000 in cash and other assets, not counting your home or vehicle. But again, that Medicaid is for those who have the financial need. And if you have more questions about that, typically a case manager at Aging Partners is going to walk you through that availability. So if Medicaid doesn't pay for long-term care, how is it paid for? It's private pay. So you're going to have a combination of different opportunity. I know people have used the term, they're saving their money for a rainy day. And this is anticipating the rainy day has come. So when you think about pay for long-term care, people will use retirement income, they'll use their savings, they'll use investments, life insurance. Sometimes you're able to use part of life insurance where if there's a death benefit and you can use that early. Reverse mortgages. So if you tapped into your home's equity for long-term care, reverse mortgage is a loan against your home and you don't have to pay it back as long as you live there, but they do get complicated. So definitely talk to a financial advisor if you're thinking about that. And then long-term care insurance, which we do quite a bit of. This will cover many of the costs of long-term care if you have a long-term care policy. I review those quite frequently with clients or people that reach out to me that want advice on what to do for their healthcare cost. If you do have a long-term care policy, you might be able to use that to bring in home care. You also might be able to use it if you move into assisted living or skilled nursing. If you haven't recently, I would encourage you to reach out to find your policy, reach out and get a current benefit statement to find out what is your policy worth today. You may have a compound or sometimes people will have like a 5% where it grew every year and their policy is worth more now than it was 20 years ago, obviously. You may also have an elimination period or a waiting period. And so that's really important to know and how you get through that waiting period to be able to start seeing long-term care reimbursement. So, and that definitely I would share that with your power of attorney so that they know where that's located should you have an emergency. What exactly does long-term care cost? This is an image. This is based on 20 hours. When you think about maybe a caregiver coming in for 4 hours a day, every day, maybe during the week, versus assisted living. This is Lincoln, Nebraska for last year versus skilled nursing. I'm going to go on to the web here. And you could do this if it was a different city or state, or if you were planning on going to Phoenix or wherever you're retiring, but you can put in, this is a Genworth, and there's a link to it on our website. You can also go on here, genworth.com, and you put in your city and state so that you're looking at real numbers. Again, this is for 2019. But it allows you to see the cost of what's an estimate so that you are prepared, you are educated, and you know what to expect. So I've got on here, many people will ask me when we're providing home care in a residence, Karla, at what point does mom or dad or do I need to make a move? And really that's different for everybody, but if only financials was the only factor involved, this calculator kind of allows you to have a really nice picture of what would be, if home care was your first option, bringing in a little bit of support as you need it, what would be that tipping point for you financially to make the move? as long as you were safe. And that was the only thing. I've got on here 40 hours. And you can see here, even having 8 hours of care, one-on-one care for 5 days a week, you're still spending less than assisted living. Let's make this 50. Okay, even 50 hours a week. So even if you had care on the weekends, you're still spending less than an assisted living. And that's based on not having levels. And that is not memory care. Memory care is more than a regular assisted living cost. And how many hours would it take? Let's go 80 to get to skilled nursing. Okay, let's see, 75. Okay, about 75 hours or so. About 75 one-on-one caregiver in your home as far as when you reach that tipping point for a skilled nursing transition. So just so you kind of have an idea and you can kind of look at if you're trying to financially plan for your future, what that might look like. Okay, so you've got that long-term care calculator that you're welcome to look at. There are a lot of other really great resources on the AARP website. So you've got a health finder, you've got the AARP home fit guide. You also have advanced directives forms. So if you don't already have your advanced directives filled out, there's a link there where you can get free copies of those forms to take a look at. We're going to dive more into that next week.
Oh, wait a minute here. Karla?
Uh-huh.
How do you get, that's the first question I had was the home fit guide, but then you've got the directives and these other things, long-term care. How did you get to this part of the website? Is there a way, do you just go to AARP and then you search for, how did you get this page or that guide? Do you just type in AARP home fit guide?
You can, yes. And I can also send those links as a email follow-up.
Oh, can you do that for that? Mm-hmm. And then on the long-term care, if I'm not interrupting by asking, long-term care, we know we kind of messed up because we did not buy a policy. And I'm in my late 60s now, and I know I should have bought one when I was still working. Do you have like a list of companies that we could check out? Or is there any way to know, like, where do you start? To find reliable long-term care companies? Is there a list somewhere that rates them for people in Lincoln looking for long-term care?
You know, that's a really great question. I can look that up and provide that and have that ready for next week.
Oh, perfect.
Yeah, so that you've got.
Because I'm 69, so is it too late to get long-term care?
Well, without going into too many details, I will just let you know for something like that, the underwriter will look at health conditions.
Okay.
And precondition, some health conditions will not allow the underwriter to write policies. So that it's really different for everybody. It's not just based on age, but I can provide some more resources on that and have them ready to go for next week.
Perfect.
Harold, you can unmute yourself. Go ahead. Try one more time. Remember, maybe I can unmute you. You see your red microphone there, if you can.
Oh, I'm sorry. Okay. There you go. Thank you. I've been a financial advisor for 22 years, and really late 60s, it's almost too expensive to get your own long-term care. But I would suggest if you've got kids in your late 40s, 50s, anywhere, they really should be checking their hybrid long-term care policies right now. But really, I think the cost for late 60s would be almost too much, even if they're healthy, to even consider. Just keep saving. But I would encourage anybody with kids in their 50s to have them start checking, because it's a lot cheaper when you're younger. The older you get, the more expensive. Just an aside.
Yeah, and I'd heard of those hybrids. I've heard of those, but you have to like put a bunch of money up front, but it might be worth it, depending on how much.
That's something you could check, but
Yeah.
that rule of thumb, yeah, 69 is, it'd be awful expensive to get long-term care, actual policy right now. Okay, that's all, Karla.
No, that's perfect. Well, Carol, you're going to be a wonderful wealth of advice for next week as well, as we get into more of the financials and legal. I'm going to stop sharing here. And so as far as resources, I will send out the PowerPoint that will have the AARP information. And any other questions? Let me see if I can see the chat. Any other questions that folks have as far as if you yourself are making plans or someone else? I'm curious on the home modifications or adaptations. Anybody in these last couple of months, have you done anything to your home to make it safer?
Yeah. Okay.
Go ahead.
I was just saying, we're building a house right now, and we wanted them, it's, not designed for aging in place initially, but they will make those modifications. And so we have to tell them. That's why I want to get that booklet. But when we were talking about the doors, they had me call, and they were talking about you could make the doors 32 inches wide rather than 36 if you didn't want the big wide doorways to start with, because most wheelchairs, if you're a smaller person, will fit through, but most of the standard ADA rules talk about the 36. That's like definitely all wheelchairs will go through the 36.
Well, and you could certainly, Barbara, as far as which doors you did that on, you could certainly make that call if that was an added expense you didn't want to do for every single door.
Yeah.
If I can show, I wonder how this would look. There's also
Yes,
but
that's what they talked about. They said if you do the 32,
hinges.
Yeah, you can make it 36 pretty easily if you take the door off and you work with those hinges. So have you known anyone who got by with a 32? There's a different, we're starting to get expensive now with ramps and grab bars and roll-in showers, and the house is all open plan. It's all on one floor. There's no basement. The entry doors are all 36 inches because that's the standard. But it was the door to the bathroom and the door, master bathroom, and the door to the master bedroom. We wanted to be wide enough. So 36 would be better. That's standard. And they were saying you could get by with 32 if you've got the hinges. You could take off the door and the hinges.
Carol, did you want to add to that?
Yeah, I had some friends who built a new house, and I would say make sure your hallways are wide enough, and then also they had their garage raised so that there was no step going into the house.
Yeah, we're going to put a little platform with a ramp so we can get in and out. Did they do anything to the front door and the back door? Because a lot of the houses they're building now, because of flooding, they're making them so they have to have one step, which doesn't, they're not zero entry. We couldn't get them to build it zero entry. They would have to build something like a little ramp or something.
I think they had it high enough in the garage. They actually raised the garage floor so there was no ramp there. It just went straight in.
Oh, okay. I see what they're doing. Yeah, because there's only one step down. They did say, yeah. They only did one, and they said you have to have one entrance and exit that is totally accessible by wheelchair, in and out.
Yeah. There you go. Thank you.
Before and after. But
that's it. That's it. Is that in the booklet?
This is in the booklet, and this is, just another option sometimes people are doing instead of creating a no-step entrance, is they'll modify their landscaping. So this is the exact same house. I'm sorry, I know that this isn't going to be as clear as I would like.
Oh, I see what she's saying. That's what they did. They raised the pavement. So there are a lot of things we could do. We should do it before it's built, because it's
And
in.
then also raise the pavement going into the garage so that the ramp is actually going into the garage.
Yeah, yeah, I see what you're saying, yeah.
Okay.
I'm curious, we talked a little bit about technology and wearables. Are any of you wearing a smartwatch or have an iPhone, smartphone?
Both.
Smartphone.
Both? Great. Another thing that, I don't know if I had mentioned it or not, but a lot of people have, if you don't have a life alert, or if you know somebody in the situation where a fall has happened before, you can use the passport pouches to make sure that you're wearing your phone if you are maneuvering a walker or something and that gets harder to hang on to. But there's just a lot of really creative ways that you can be comfortable and stylish and safe and have a lifelong living space. So I thank you so much for joining Living Longer, Living Smarter, and I will look forward to seeing you at the same time next week for part 2.
Okay.
Oh, and
Have a good weekend.
Karla, when you get to talking about finances, will you be talking also about, like, if you can get an aid just for like once a week or twice a week to help with groceries or other
Sure,
things?
yeah,
Cooking, just limited.
You bet we can get into that. I'll be glad to provide that to you.
Oh, that'd be great. Yeah, because after what you said, I really, once we buy the house, we want to stay there a long time.
Well, I'm glad that you're thinking ahead, and that's exactly what the goal is. So easier to do those things now than to have to retrofit, which you can still retrofit things such as bathtubs and so forth. But if you are starting from scratch, easier to do it now the way you want it and the way that it will fit your life as you age safely. So
Thank you.
thank you all. Have a great weekend, and I will see you next week.